Welcome everyone to the call. Just bear with us for a couple more minutes. We're just expecting quite a few more people. They're coming from a Microsoft Teams link. So just a couple more minutes. Thanks for joining. Again, a warm welcome to everybody. Just a couple more minutes. I think our co-chairs are joining. Thank you. Okay, so warm welcome to everybody. Various people are joining still, but I think we'll get started and show respect to those that were here on time. Again, a warm welcome on behalf of the Secretariat, my colleagues Moenia, Tashi, Pandula, Isabella, and Nina. Thanks for joining. My name's Craig Burgess. I work at WHO, but in that role, also play the role of the Secretariat. And going to hand over in a bit to our co-chairs, Steve McFeely, who many of you know, and Onalena. Dr. Onalena works in the Ministry of Health in Botswana, and our colleague JP from UNICEF, who are all going to welcome you to this workshop. And just before we start, we're going to go through a round of welcomes, and then I'm going to take you through the agenda. But we really want to emphasize this is a meeting where it's your meeting, it's your workshop, and it's your collaborative. And we're really hoping for good, open, frank, and transparent feedback on the evaluation of the HDC, which has taken place between this year, between March and September, and evaluated the Health Data Collaborative between the years of 2015 and 2022. So we're really, this time of the meeting is really crucial because we're at the midpoints for the SDGs. It's an important call, and we really hope active participation. A warm welcome to everyone. And over to you, one of our co-chairs, Steve McFeely. You can read there, Director, Department of Data Analytics in DDI in WHO. So Steve, over to you first of all to welcome everyone. Thank you.
Thanks, Craig. Good morning, good afternoon, good evening to everybody, and thanks for tuning in. So where to begin? This HDC evaluation, I think, is very timely. It comes at the midpoint of the SDG cycle. And as an informal collaborative, it evaluates a partnership approach to data. And I think that's important because the same week at UNGA, we see lots of reports coming out. We see our own UHC report coming out. We see how we're falling short in many respects. But at the same time, all the time, we see the importance of partnership. And without that, we really can't achieve anything. So the objective of the evaluation was to allow us to reflect on the HDC's efforts over the last number of years. What lessons can we learn from what we've done, what worked, what hasn't worked, and most importantly, to help us identify areas that can be improved and make more impact at the country level, which is really what it's all about. It will also help, I think, with the credibility and the participation. This is an objective and independent evaluation of the HDC done by SEPA. So they've had an absolutely free hand. They've done in-depth country reviews. I think it's been an open process, and they've involved over 60 stakeholder consultations. And thanks to all of you who've given the time and participated in those. What we're interested in is the HDC's value added. Like their recommendations really focus on value added. I think that's really the important piece. Where do we add value and where don't we add value? And what's the way forward so that we can add value for countries in the context of a collaboration that involves, when you think about it, more than 1,000 individual members and 300 partner organizations. So with that amount of collaboration, are we achieving enough? I think the recommendations are well defined, they're practical, they're clear. I think they've done frank reviews of the strengths and weaknesses of the HDC. The main task now is to look at how to implement their recommendations over the next 6 months, and in particular to get your feedback on those. I mean, at the end of the day, we're the Secretariat, but we're not the HDC. You are the members. So what's your view on the recommendations? What should we prioritize, and how do we do it? So the aim of this workshop is to get your feedback on how best to implement the recommendations, on the recommendations themselves. Is there anything you're unclear about? Is there anything that you can do to help us? And really to improve the support and ownership of the HDC. So with that, I'd just like to thank SEPA for their independent and objective evaluation of the HDC, to thank all of you, the members, for actively participating in the consultations and giving your time. And then also, just to make the point, this is a collaborative platform. We have a unique opportunity, I think, to make a difference in countries and in their data systems together. But it's your collaborative, not ours. We're simply the Secretariat. But we would like to thank you all for your engagement and time over the last 7 years. Just to finish with perhaps an indelicate matter, but one that's important, is resources. The HDC itself is not very heavily resourced. And yet it does a huge amount. We have a number of working groups, whether on the data and digital governance, on the CRBS, on the health information systems. And they've done a tremendous amount of work, including harmonizing the missions across agencies. But we do need resources, both financial and political. And I think that's one of the things we would like to discuss going into the future as well. So I'm looking forward to hearing your suggestions. And I think now I hand over to Elena directly for additional remarks. So thank you.
Good afternoon, good morning, good day, colleagues. I'm just showing my face and then I'll turn off my camera because of the network issues that I'm having here. I hope I'm audible.
You are, Elena. We can hear you. Thanks.
Let me also just take this opportunity to welcome you, colleagues, to this very important HDC Evaluation Workshop. I want to appreciate everybody who is here for finding time to participate in the workshop. We are here, as you all know, to receive the HDC final evaluation report and the recommendations. Let me appreciate the HDC community at large for prioritizing evaluation of HDC, and the Secretariat for meticulously facilitating the process and organizing this meeting. You know, human nature, it is not always easy when you are doing something to want to be evaluated, especially by external evaluators. But I think that was a very important step, and to say we need somebody coming with a different eye to look at HDC and give us the recommendations for us to be able to improve. After receiving this report, it is upon HDC at large to carefully study the findings and recommendations and prioritize implementation of critical activities that will have an impact on HDC. We know, all of us, that HDC strives for relevance, especially at country levels, for efficiency and effectiveness, as well as sustainability in our quest to improve data use across countries. So an important objective of this workshop will be to agree on implementation of key recommendations that are really going to assist HDC to be able to do that. I therefore urge all of us to be free to engage so that we can have a fruitful deliberation and the outcome of this meeting. Last but not least, I want to thank our consultants. They really did a sterling job with this evaluation. I appreciated the openness and the professionalism of the report, which is really going to help us in a big way to look at ourselves and make sure that we change for the better. I thank you so much. Welcome.
Thank you, Annalena, for your words of welcome. Now I'm going to turn to our UNICEF colleague, JP, for welcome as a co-chair. Thanks, JP.
Thank you very much, Craig. So my name is João Pedro Azevedo. I'm the Chief Statistician of UNICEF. And I want to start by thanking you all for giving us a bit of a time to provide some initial reflections and opening remarks. And really take this opportunity to thank the HD Secretariat, colleagues from WHO, and the colleagues from UNICEF, the staff from UNICEF that have been coordinating this exercise. I also want to acknowledge and thank the Cambridge Economic Policy Associates, CEPA, for conducting this evaluation and sharing their findings. The evaluation objectives, as stated in the report, are to help the HDC reorient itself to focus and address necessary data needs to speed up the process to the 2030 health-related SDGs. This is the timing of this workshop couldn't be better, right? As all of you know, we are right at the middle of UNGA, the UN General Assembly, which the topic has been the SDG summit, right? In the midpoint of the SDGs. But the real meetings, the conversations that really matters are these ones, right? Are workshops like this, because these are the workshops that have the real impact on the ground. And for us, this is what really matters, and it's with this spirit that we are engaging here today. As we discuss and learn about the findings of this evaluation, it's really important to really open the discussion regarding the coherence, the relevance, the efficiency, the effectiveness, and the sustainability of our impacts. As Steve mentioned, funding is an issue, and I also hope we'll have a chance to discuss. But I do believe that evaluations such as this help position us in a better place in order to fundraise. I'm certainly not here to preempt the findings of the report. I think this is really what we're here to learn from and the colleagues from Cambridge Analytics, but rather to just highlight that we do find mixed results, right? And we need to think about them as we think about this second phase of the SDG process and how we can strengthen our coordination and efficiencies and build on the successes that we have achieved to this date, but also learn lessons from areas in which we haven't really worked as well, or where progress hasn't been as strong. I would also like to encourage all the participants to really engage in this next 3 hours, to really open freely and actively, share your views. Let's discuss these findings. We probably won't reach consensus on everything in the meeting, but I think we need to continue this conversation, right? This is as I said, these are the meetings that really, really matter. So we can have a stronger and more effective impact on the ground. So I would like to just close and thank you and wish you all a great meeting. Thank you. To you, Craig.
Thank you, João Pedro, JP, and thank you, Steve, Onalena, and JP for your words of welcome. I'm going to be very brief here, but I'd like to just reassure you that everyone should have access to the Google Drive, which includes the agenda, the SEPA final report, and the 6-country case studies. In case you don't, it's in the chat and you can access it there. What I'd like to do just now is just quickly go over the agenda to make sure everybody understands what we're trying to do between now and really a couple of hours time, 2.25 hours, is to present the final report and recommendations of the evaluation, which is what SEPA is going to do, to agree on implementation of the recommendations. And we've suggested in the next 6 months, what are we really going to concretely do in the next 6 months together as a collaborative to really speed up the momentum as we move forward? And for those of you who don't know, we're planning a face-to-face meeting in the last week of November. Hopefully that will move ahead, and that's an opportunity for various countries and HDC stakeholders to come together and review some of the work plans that we're going to be talking about in the next month. And then the third objective of this workshop is really to define clear roles and responsibilities for the implementation of the recommendations. The recommendations we made, we really want to hear good ideas, frank ideas, and ideally volunteer spirit to really move things forward for the HDC. As I said at the beginning, and I think all of our 3 welcome speakers said, it's your collaborative, so a joint ownership. So I'm going to hand over in a bit to Kaveri Kumar and colleagues at SEPA who are going to present the findings and recommendations. And after that, there will be question and answer sessions for points of clarification or anything that you wish to raise. And then after that, we're going to break into 4 breakout rooms, and that'll be introduced by my colleagues Tashi and Mwenya. Each of you will be allocated a breakout room on 4 elements of the recommendations. You'll find that the findings are grouped into relevance and coherence, efficiency, effectiveness, sustainability, impact, and the recommendations, of which there are 5, are grouped into strategic and operational. And you'll be broken into breakout rooms where we hope to get a lot more in-depth discussion going on your recommendations. We'll come back at the end of the breakout rooms and then we'll have a wrap up on next steps. There will be opportunity for you all to input as a plenary after SEPA's presented and at the end of the breakout rooms as well. So thanks again for joining, a warm welcome, and I'm going to hand over to Kaveri Kumar of SEPA colleagues who've undertaken the evaluation on your behalf, on behalf of the HDC. So Kaveri, a warm welcome to you and Christian and your colleague Anissa. Thank you.
Great, thank you very much, Craig and HDC colleagues and partners on the call today. Craig just introduced us, but I'll just very quickly introduce us. As you can probably see from the strap lines on our faces on the screen, they're the 3 of us here from Cambridge Economic Policy Associates, myself, Kaveri, I've led this evaluation, and Christian and Anissa, who have been the core evaluators for this assignment. So hello from us, and we're very excited to reach this sort of milestone in the evaluation work, where we have a chance to present the final findings and conclusions to you, as well as the recommendations, and then really sort of work with you to sort of brainstorm and think through what is required to implement these recommendations. So with that, we are going to turn off our screens here again, just to maximize on the presentation space. And let me just share my screen now for the presentation. Yeah, okay. You can just bear with me for a minute while I put it on, please. Oops. Okay. And just to check, everyone can hear me? I can't see my screen.
Yes, we
okay,
can.
Great.
Thanks.
So in terms of the next sort of 15 minutes or so, we are going to provide you an introduction to this evaluation, just a recap on the objectives and the scope. We are then going to provide you the overview of the findings and conclusions, and that would serve as a good base to then really focus on the recommendations, which is the objective of all of us gathering here today. So by way of an introduction, as you're all well aware, and for those who are joining for the first time as well, just to reiterate that this evaluation was commissioned earlier this year with the objective to review the HDC from inception in 2015 to end of last year, with the idea to consider how the HDC can better position itself for impact with regards to data on supporting progress for the health-related SDGs at the country level. You can see this figure on the slide, which is quite dense, and it is sort of explained in more detail in the report, which is accessible to everyone on the Google Drive. But just to very quickly explain that we have structured the evaluation as per the standard OECD DAC evaluation criteria. These are the standard evaluation criteria that are recommended for an evaluation of this nature, where we look at the relevance of an initiative or a program, its coherence with others, its efficiency in functioning, and then its results in terms of effectiveness, sustainability, and impact. And really, we developed a series of questions across these pillars, which have informed our overall conclusions, lessons learned, and recommendations. I think our colleagues who introduced sort of provided a helpful recap of the approaches to this evaluation, which comprised a number of methods, including document review, interviews, 6 country case studies where we had an opportunity to gain perspectives from a range of different country contexts and a range of different country experiences with the HDC to date. We had a short e-survey with a few responses, but it helped extend our interview reach, and a few more sort of methods that supported this review. Just to say that towards, with the conclusion of this evaluation through the final report that was shared with all of yourselves, we are also currently working with Craig and colleagues at the Secretariat to translate the findings into an article that could potentially be published for wider access to a wider stakeholder group. So then I'm just going to pass on to my colleague Christian, who's going to run us through the findings and conclusions before I take over again for the recommendations.
Thank you very much, Kaveri. And just in the interest of time, I will keep this presentation on the findings relatively short. So just to start off with the relevance and coherence section, one of the key findings has been that the HDC objectives are relevant to country priorities and needs, but that in their current form, they're too broad, unclear to stakeholders, and too ambitious in relation to the current HDC structure and the available resources. There's also been a lack of clarity on what exactly the HDC is doing in support of the objectives, with some HDC activities seen as lacking focus and not presenting an integrated plan towards the objectives. Also, the HDC model can be improved further and requires reform to deliver on its mandate. One of the key strengths lies within the multi-stakeholder base and the convening power of the HDC, which was really seen as the added value. But to leverage that, the HDC needs to more meaningfully engage with its partners. Another aspect has been to strengthen country engagement, and then also to improve on the governance structure with the current structure seen as very complicated for its size and budget, and requiring also to provide better strategic direction and accountability. Another aspect has been that the HDC should more clearly and concisely articulate its value add proposition to partners, as well as, in particular, country stakeholders. Going to the next section on efficiency. So just to provide a little bit more detail with regards to the point on the governance structure being seen as complex, given the limited human and financial resources. One of the aspects that was critiqued was the constituency structure that was seen as burdensome with limited value by a majority of stakeholders, and as well as challenges with the SRG with regards to providing the necessary strategic direction, including due to the member engagement that could be improved, as well as more clarity needed with regards to the purposes and the procedures of different SRG meetings. With regards to the working groups, it was seen that there's a significant variation in the structure and as well as the purpose of the different working groups, with in some instances led to confusion among stakeholders on their specific roles, as well as with the delivery and the accountability within working groups. And lastly, it's important to note that the Secretariat has been really acting in a highly constrained environment with regards to resources, and increasingly has had to drive the work of the HDC. The diversity of the HDC membership base was really regarded as a key strength, even though only a small percentage of the members are very active. The communication flows between the different HDC governance structures could be improved further as well, which was helped with regards to decision-making, transparency, and coordination. And lastly, with regards to the SDG Gap accelerator merger, this was considered to be helpful and leading to some efficiencies, but the implementation could have been done in a more strategic and transparent way, with there actually being low visibility and understanding of the merger among many stakeholders. Moving to the next pillar with regards to effectiveness, impact, and sustainability, it was seen that the theory of change and the M&E framework were not used widely and largely poorly understood by the stakeholders, leading in particular to ad hoc progress reporting. And a key finding with regards to the effectiveness and the impact has been that there, to date at least, have been limited progress with regards to the HDC's 3 objectives. This is partly due to a range of challenges that are internal facing, as mentioned with regard to the structure and design, the long periods of the break in 2018, but also really external factors that are outside of the control of the HDC. Of course, like the most recent example of this being COVID-19, that also diverted attention away, changing priorities within 2021, 2022. Though it is also to note that COVID-19 was also mentioned by others as a opportunity and really emphasizing the need for data coordination. So the next slide really provides a detailed assessment of the different HDC areas of work, including the knowledge brokering, advocacy, the working groups, as well as the country level activities. So this is all detailed in the report. So for the interest of time, I'll just move to the conclusions and findings summary. So the HDC really launched in 2015 with a heightened political commitment and received the necessary support in the years after, but then had a break due to changes in the global health landscape, including the WHO transformation agenda. And then the reorientation in 2019-2020 identified very similar challenges that we also identified as part of this 2023 evaluation. So this really leads to an important crossroad, and we have already heard from the welcome speakers around the timely process around this evaluation, really showing that this is like an important time to decide what the next steps are. And the evaluation showed that stakeholders nearly unanimous said that there's a need for the HDC, but that it should be reorientated and reformed, but not disbanded. And again, this emphasis around the multi-partner structure was seen as critical. However, there's a number of the persistent challenges that remain and need to be addressed for the HDC to become more effective. And the key ones really are the broad and too ambitious objectives related to the resources, the lack of clarity among stakeholders on what the HDC is set up to do, what it does in practice, and how to engage with the HDC, the heavy-handed governance structure, the need for further partner improvement, a need for further country focus and country engagement, and then lastly, an improved communication and awareness of the progress and the results that the HDC facilitated. And so with those conclusions, I will hand over to Kaveri, who will talk through the proposed recommendations to address these.
Thank you, Christian. So to move on to the recommendations, which is the meat of this conversation of this workshop today. So we are going to present for you a total of 5 recommendations. And the first recommendation, which would form the base of what has been set up as the first breakout session as well, is in terms of the scope of the HDC and its areas of focus. So the recommendation from this evaluation is to reduce the scope of the HDC, to focus on where it can add value and has a comparative advantage, and then to really sort of line up in relation to this defined scope of HDC in terms of supporting it with a clear theory of change, a work plan, and an M&E framework. In this slide, in sort of blue highlight, and you'll see this format in the subsequent slides on the recommendations as well, we provided an indication of who is responsible for this recommendation, for the implementation of it. And we're really hoping that provides food for thought or for discussion at your breakout sessions. We also provide some thought on timelines, what's immediate, and what is, something that can be looked at in the medium term. We've looked at capacity requirements, and really in sort of thinking through these 3 aspects of each of the recommendations, we've thought about what is priority, what should be done now, and thought about sort of balancing the work, recognizing that, this work in terms of implementing the recommendations is not the responsibility of the Secretariat alone, but very much to be built up from the partners. You'd notice that the implementation responsibility refers to an HDC board, which may be confusing for some, but just to say that we make a recommendation number 2, which will come in the subsequent slide, to set up an HDC board to guide the strategic direction of HDC. So I'll just talk about that in a minute, but just to very quickly talk about this first recommendation. As I said, it's about thinking through the scope of the HDC and reducing its scope, given its available resources, its informal setup in terms of partner engagement. So really matching its resources to what it can do. This would allow HDC to be sharper in its profile, better communicate its value add. And this should be done through a clear sort of 1-page concept note where stakeholders are very clear that these are the areas of focus and this is the approach of the HDC, and equally, what the HDC does not do. And in support of this sort of defined scope of the HDC, as is good practice, to develop a supporting theory of change, again, sort of built up through sort of close engagement with with partners and sort of to help define a good theory of change. Developing a work plan. We're not suggesting an arduous effort towards developing a complicated work plan, but something that builds up from key partner work plans and identifies priorities where the HDC, by virtue of its large member base, can add value and help sort of take forward these plans would be in order. So in essence, given the HDC base, its sort of main added value of its partner, its member base, to leverage that and ensure that the sum of the parts are larger than the actual sum, if you know what I mean, in terms of partner work plans and activities. Just to clarify that we are not indicating that this should be sort of Western-led or global organization-led. We very much recognize the resources at the hand of available to the HDC and suggest that some of the big funders, who have a country lens, who are discussing and engaging to identify country priorities. So, that could be one sort of more tangible and achievable and an efficient way to sort of define areas of HDC, recognizing that this approach is very much built up from identifying country priorities and engaging with countries. Developing an M&E framework in support of this approach. This is critical for all initiatives. We're encouraging something that's light touch, but yet a core part of the HDC, and it would help ensure its added value and progress to stakeholders over time. And also an investment case around it. Again, many of you at the start have mentioned the need for financial resources for the HDC to better deliver on its work. So really on this newly defined or renewed scope of work, to develop an investment case that should be used as a communication as well as a fundraising tool to help raise both financial and in-kind resources. And by in-kind, we mean, staff secondments or other support from partner organizations. And then very quickly, just to sort of add a little bit more color to this recommendation, in our evaluation, we provide a view on the HDC's role going forward. This obviously needs to be discussed with you as the partners and the owners of the HDC and reach a position in terms of what is the HDC role. But from our perspective, based on the range of reviews and consultations and analysis that we've conducted for this evaluation, our suggestion is, on the basis of considering the HDC's positioning, its resources, what it really means to have meaningful country engagement, we suggest a role that is definitely aimed at country impact, but through global coordination. It focuses on a sort of a 3 main areas of work. On knowledge brokering is the first area, which is about developing knowledge products or supporting their development and dissemination. Number 2, supporting their learning through workshops and conferences. And number 3, advocacy and communications for more efficient and effective health information systems, focusing more on donor coordination and the costs of fragmentation. The areas where we think HDC should not consider or deprioritize, and we like to flag these here because there is a lot of confusion in terms of what the HDC should be doing and not doing, and different stakeholder perceptions. And we wanted to be clear that the HDC should not look to function as a funding entity. It should not look to provide direct support for operationalization of country coordination mechanisms for data, because it does not have that capacity at the country level. It should not look at wider capacity building through direct TA provision, recognizing TA landscape is already quite crowded, and also the need for a country-by-country approach for this kind of provision. And then finally, look at doing more engaged work on affecting donor alignment and coordination, but sort of look at it from the advocacy angle, recognizing how the big funders for data function and their coordination, and where the HDC could add value here. So the next recommendation is about the HDC governance structure, and this I think is set up as the topic for the second breakout room. So for that, we would suggest that the HDC really look at simplifying the governance structure, creating a small board to provide strategic direction to the HDC, remove the constituency-focused arrangements, given the challenges identified with this setup in terms of its added value, as highlighted by Christian in his presentation of findings. And what we're saying here is, to really look at the governance structure of the HDC, make it light touch, set up a small board that is very much engaged with the mandate and activities of the HDC and helps define them and take them forward in terms of strategic direction. It should be a small group of about 5 to 7 members. It should reflect some of the largest funders of HIS, the technical partners, and stakeholders from the country and the CSO level. But we wanted to highlight that this is not about representation. This is about ensuring engagement. So it's about it is about comprising a board that can really engage with the HDC work and take it forward. It's not a political level board that we are proposing, but senior representation would be important. Yeah, I think that sort of summarizes the main points made on this slide. Moving on then to the third recommendation, and maybe if I could just jump to the next one, because it's sort of compiled with the breakout session, and then I'll come back to recommendation 3. But recommendation 4 says implement actions to enhance effectiveness of the working groups and ensure their outputs are directly relevant for countries. And a number of discrete recommendations within this, which we think are actionable and practical in terms of supporting the better efficacy of the working groups. So looking at developing annual plans or deliverables with supporting timelines for the different working groups to support, their knowledge on their functioning and also to support follow-up. Ensure country engagement at the working groups, and we provide sort of 3 points here about how to encourage greater country engagement in the working groups, so that their voice and that their expertise is well reflected. Improve connection and collaboration between the working groups, possibly say through joint knowledge products or other approaches. Importantly, for the HDC Secretariat to continue to support the working group work and their coordination, which has been seen as an added value for many of the hard-pressed for time members that are involved in the working groups. And also looking at the funding aspects for the working groups, where there is a potential or options to facilitate access to partner funding to support some of the deliverables of the working groups. And as I said, I'll just go back to the previous recommendation. So recommendation 3, and this would inform the third breakout session that has been structured. And this says improve the engagement with countries by developing a country engagement strategy that is well communicated and understood. And move away from the approach that the HDC currently has on a pre-selected list of countries to focus on, rather be more open. The pre-selected list has sort of caused confusion and some missed opportunities as well. So I think we recommend that it should function more as a global level facilitator rather than focus on a few specific countries. So I think in terms of the detail, maybe nothing much more to add here. Just maybe quickly to point your attention to the third bullet here, which is about looking at ways to strengthen country engagement and bottom-up sort of approaches to drive the HDC's work. And we provide some suggestions here in terms of ensuring that, you know, and a structure like the HDC, how can it ensure that it's sort of built bottom-up and has that country sort of feedback and input. The last bullet point on this slide is also important to highlight, where we note that in order to ensure effective engagement with countries and added value for countries from the HDC, really to ensure to reorient events and meetings and workshops to maximize utility for countries. So really looking at it from the country perspective, structuring these meetings, their agendas, their focus, and their participation to really see what would benefit from the country perspective. And one important suggestion here is to ensure more South-South sort of experiences to be shared in some of these workshops so countries can benefit from each other's experiences. So to move on now to the next one, and I think this is final recommendation here, 5, which would support the final breakout session that we would have following here. So this says ensure streamlined and focused communications tailored to different audiences and stakeholders, and carefully consider the added value of these communications for respective stakeholders. And this recommendation really builds up from the range of findings that Christian presented to you a little while ago, where the different governance meetings, but also other sort of events, have been viewed as requiring more sharpening of focus and tailoring to the participant needs. And so we suggest that there should be more work done to communicate to HDC members in a more tailored and targeted fashion, to map out the different type of information and communication needs and sort of key audiences and how best to reach them. HDC meetings should become more targeted with a clear agenda and follow-up action points, and really looking at it from the lens of value add for the participants rather than sort of, sort of a more generalized, standardized approach. Also to support this communication through improvements at the website. There was some feedback from country stakeholders that it's more oriented to define what the HDC does rather than access the different knowledge products and tools that would be useful. So whether to look at it through the website or other collaboration tools, but to sort of essentially provide a better platform where this communication and dissemination of available tools and products can be made more accessible for countries. So with that, I will stop our presentation, which has come to an end, and maybe pass on back to others, maybe to Craig, to take us forward in terms of the discussion.
Sure, thanks, Kaveri, Christian, and Anissa. We now have kind of opportunity really for anyone to, before we go in the breakout session, to ask questions specifically to SEPA to get their thinking, any points of clarification on the evaluation, either the conclusions or the recommendations that you heard. So if you want to either use the Q&A function or put your hand up and we can turn to you. So Kaveri, are you okay to take kind of 3 questions and then take them all together, or do you want one by one?
3 questions is good.
Okay. Okay, thanks. So first on my list is Pam Dixon and then Nicola. So Pam, do you want to go, and then Nicola? Thanks.
Oh, thank you so much. Just one time again, I've said this before, but I really appreciate the recommendations and the work you did on this evaluation. I thought it was really well done. I did, from my perspective, both as academia, but also civil society, one of the issues within HDC that did not come up in the evaluation is that there was a real missing of civil society in the group. for a number of reasons that are readily understandable. But I do believe that some of the recommendations are for a bottom-up approach in some areas, but the board has mainly top-down members. So I think that this is a really difficult recommendation in this particular regard. And I would say that in thinking about other boards like this and other institutions, that what you, even though it is not fully representative, you need to make sure that there's a real balance between bottom-up approaches represented and top-down. So for example, civil society needs at least 2 seats on that board to remain engaged. And I would say also standards bodies, at least 1 person from a standard body. It's really important. And at a very minimum, 1 implementer who really has worked on the ground and can ground truth some of the recommendations that are coming from more top-down entities such as funders, which I agree are essential. But I think we have to be very, very cautious, because I've been on boards where it has been, you know, a preponderance of funders, and things tend to get very ambitious. And this is usually held in check by civil society implementers and standards folks. So that's just a really, it's an observation and a recommendation I would make. But I'm going to be very interested to hear back from others and what they think about this. But broadly agree that a lighter governance structure and more nimble and agile would be really useful. Thank you very much. And again, thank you for your work.
Thanks, Pam. Nicola, do you want to go next? Do you want to just briefly introduce yourself? Then I think we've got Maxwell. Thanks.
Sure, thanks. My name is Nicola Wardrop. I'm the representative from UK FCDO. So I just wanted to also say thanks for the great work. I think it's a really in-depth evaluation, and I think the recommendations ring quite true for me from our perspective. So thanks to the team for all the work. I have quite a quick question really, just about whether you've given any thought to what the recommendations might mean in relation to the merger between the HDC and the SDG Gap Data and Digital Accelerator. Thanks.
Thanks, Nicola. Maxwell?
Thanks, Craig. And let me express my gratitude to the SEPA team for, I think they've done a great job. So just a quick question from my end. I heard that we are recommending that HDC avoid spreading itself too thinly. And then also I heard another one that they should avoid pre-selected countries. And I'm thinking these may not necessarily align. I thought that the pre-selected countries help HDC to be more focused. So if you could please clarify how the two can align. If we don't pre-select, and we can also, how can we also avoid spreading ourselves too thinly? Yes, over to you, Craig.
Great, thanks, Maxwell. So Kaveri and team, I don't know whether you want to kind of take a stab at them. We got a question from Pam on engaging civil society in the board and making sure they're represented. Any thoughts on how the board will be lighter? Anything that you heard? Then we had the question on Nicola on the merger of with the SDG Gap. Any thoughts on how we should communicate that and what that should look like? And then our last one from Maxwell, this balance between indeed the need for focusing more, but how do we do that if we're not going to pre-select countries? Thanks, Kaveri. Any thoughts?
Oh, thank you. And thanks for everyone. Your kind words are much appreciated. And we're really happy to sort of hear resonance in terms of our work and recommendations. So thank you for sort of calling that out as you provided comments. I think all 3 comments are really interesting and important ones. A few thoughts in response. So I think first, Pam, fully agree with you, and representation is so critical, and that there's so much importance and power in representation. So but I think one challenge is that there was a reorientation plan for the HDC a few years ago, and some of our findings are pretty much similar to that sort of intended rebooting. We're saying now, let's look at rebooting the HDC, and we really, we really feel that it needs to now be driven, at least in the initial period, by a very engaged board. And if we are sort of, now that does not suggest that we do not have CSO or standards or implemented representation. Indeed, I think all the groups that you called out are very important, but I think it's about balancing, where the HDC is at present, the need for really a board type structure to guide and take it forward. And that means people who can be fully engaged and can provide that time and really sort of help take the HDC mandate forward. So I think in summary, what I'm trying to say is that, your representation point is well noted and is very important. Perhaps, and indeed the board construct of 5 to 7 individuals, as we are suggesting, could very well include the groups that you're mentioning. But it could also be sort of thought of as a sort of a timeline of events. I mean, really at this stage to sort of reboot and reorient and redirect the HDC and help it get back on track. And then, as it gets back on track and there's further traction, there could be, other ambitions and sort of thoughts about how to make the board, more representative or have other objectives for the board. So that would be sort of our thoughts, and we'd welcome any further comments, Pam, as well on that if you'd like to. Nicola, thanks very much for your comments, and also thank you very much for the comments that you shared on email with Craig and others, which we also received. I thought your comments were really spot on and very helpful to help us finalize this report. On your question, I don't have a specific answer, except that the future direction of the HDC should very well take account of the merger. So it needs to think about a scope of work and activities that harness or leverage the work and the mandate and the capacities of both of these sort of entities. But in terms of specifics, it would be good to sort of flesh that out as the HDC role is defined going forward. And then finally, Maxwell, in terms of your comment, it was a good one and sort of had me thinking very quickly. But I think when we say for the HDC to avoid spreading itself too thin, I think we're referring to being clear about what the HDC can and cannot do. So, for example, it should be very clear that the HDC is not a funding entity, and there's been areas and instances of misunderstanding regarding that in terms of what the HDC can do. So, but also more generally, it can't do everything. It needs to really define its focus. But then when we say on top of that to avoid pre-selected countries, it's been more because there's a sort of a dissonance between, then sort of responding to other country needs as they come up. And the sort of focus on a country-by-country approach in our review has not led to very tangible results to date, because the HDC, through its current structure and its setup, has not been able to sort of follow through on specifics with each country. So rather than sort of following this country-by-country approach where it doesn't have the hands and feet and capacity to sort of take it through, we propose that it would be better it's sort of set up at a more global level. There may still be direct country engagements and requests and approaches that come up, but its starting point should be openness to respond to any country needs rather than a list of countries. I'll stop there and maybe pass back to Craig, please, to take us forward.
Sure, thanks, Kaveri, and everyone. There's a couple more questions in the chat, but I wonder before I read them out or we respond to them, whether anyone else, and bear in mind, a lot of this will be discussed during the breakout rooms, but does anybody else have any other questions specifically for Kaveri and team? If so, put your hand up or put them in the Q&A. I got a question here actually from David Boone. So Kaveri, this is for you. It's basically from David Boone. It says, how can HDC preserve or enhance its vital role of curator of standard tools, methods, and best practices for health data system strengthening, and be the authority on what works and what does not, and promote these to ensure standards and harmonization? So I'm presuming you can also read that, Kaveri, but that's one question from David Boone. I don't know, David, if you're on the call, whether you want to just briefly introduce yourself. And then there's a question from Rachel who has a raised hand. So David, if you're on the call, do you want to introduce yourself and a little bit about your background? And Rachel, thanks.
Sure. Dave Boone from the Country Health Information System and Data Use Project for USAID funded projects on HIS strengthening. and I serve as the strategic objective lead for data analysis and use.
Great, thanks, David. And then got your colleague Rachel from USAID. Do you want to go ahead? Thanks.
Sure. So first, thank you so much, Kaveri and team, and Craig and team for hosting this and for all this great work. I'm Rachel Lucas. I'm a senior data advisor in the Global Health Bureau at USAID. And I'm not sure if I should ask my question now or if maybe David's question should be addressed first.
Why don't you go ahead just now, Rachel, if it's specifically for the SEPA team now that we've kind of got them, and then we'll go into the breakout session. So go ahead, Rachel. Thanks.
Sure. Great, thank you. So my question is, and maybe I missed this in the report, what were the assumptions that we were making or that were made in terms of making these recommendations relating to resources? Is the assumption that are these recommendations made in a resource neutral way? Or were there assumptions made around kind of the resource envelope being, maintaining a status quo or decreasing resources or increasing resources? In other words, a lot of the recommendations revolve around what is the current funding and resources allocated towards HDC. And I'm wondering if that was what was assumed would be kind of projected out into the future. I hope that's clear, and if not, I can clarify.
Great, thanks, Rachel. And I think we'll just take one last one from Manish Kumar, which is in the chat again. So Kaveri, this one's for you. How can HDC strengthen regional or global networks focused on health data systems and avoid overlapping with those networks? Was there anything in the evaluation that came up? But Manish, do you want to just quickly introduce yourself and then hand over to Kaveri for those 3 questions? Thanks. No, I guess Manish is off. So Kaveri, are you okay to answer those 3 questions? One from David Boone on the kind of the standards and then the role of the HDC, and the one from Rachel on the assumptions made that you might have made before making the recommendations for resources. And then lastly from Manish was there anything that came up in the evaluation about avoiding overlapping different networks? Thanks. Manish, do you want to introduce yourself? Go ahead, Manish.
Yes, thank you. Sorry, it took me a few seconds to unmute. Yeah, so I work with a consulting firm called Guidehouse, but I've been working with HDC since the beginning through USAID projects and focusing on data systems and digital health. Thank you.
Thanks, Manish. Okay, so Kaveri, do you want to just take those the 3 questions, and then we'll go into the breakout? Kaveri, thanks.
Thanks, Craig. Maybe I'll just first reply to Rachel's questions around the underlying assumptions for the recommendations. So that was mostly guided by the current resources for the HDC. So within a limited sort of resource envelope. That was in particular with regards to the assumptions around the objectives and the scope. So in that way, we didn't assume that there would be a big increase, for example, in resources. If that would be the case, then of course the scope could be adjusted further. So we very much work with regards to the status quo at the moment.
Yeah, and I think that's very much reflective of sort of the landscape at present. I mean, post COVID, the financial tightening of budgets across. So we sort of assumed a similar, but potentially slightly increased resource envelope because it really is quite limited to resources. On the next 2 questions, and apologies, we're just catching up with them. We were looking for them on the chat, but we noticed they've been pasted in another box called Q&A. So just a little bit slow to respond, but just reading the question from Manish on other data networks. I think in our review, other data networks, especially on the digital side, were flagged. And, people asked about the HDC's added value in comparison. And I think our review showed that, the HDC is much wider in scope, and some of these other groups are quite focused. They're doing a lot of great work, and there's lots of, scope for coordination and linkage up with the HDC. But fundamentally, the HDC has an important space to play, given its sort of more wider focus. It's not sort of topic restricted in a way. And in terms of the coordination, I mean, it could be through the working groups, it could be through the member engagements. It sort of needs to also be sort of initiative-led in terms of how it's taken forward. The last or the first question from David, and if you can just bear with us as we sort of read the question through. So about preserving and enhancing its role of on tools and methods and best practices. Yeah, I think this is really sort of, I think we, through our recommendations, we are suggesting a reboot of the HDC, better direction, and that would sort of form the basis of greater partner engagement. I mean, I think if partners know that they are working, for an initiative, with a very defined approach, then the credibility overall enhances. So I think in that respect, HDC has an important role to play with regards to, tools and standards and access, and it would be sort of built on the back of its sort of greater credibility and sort of coordinating role that would hopefully be enhanced through the recommendations implementation. Sorry, David, I don't know if I fully answered the question because I'm sort of reading live, but if you have a follow-up, please feel free to sort of mention it verbally as well.
It's okay, thank you.
Okay, so thanks, Kaveri. And again, I think I'm going to echo almost everyone on the HDC call just now. A huge thanks to SIPA for all your work. We had a Q&A. We're a little bit behind time, but what we'd like to do now is go into the breakout rooms. My colleague Tashi is going to just take you through the logistics of that, where you're going to be split into 4 different breakout rooms. And over to you, Tashi. There'll be 30 minutes and then you'll come back to plenary. So Tashi, over to you to explain to everyone. Thank you.
Thanks, Craig, and thank you, everyone. Great discussion. Now that the evaluation has been completed over a course of 6 months, an external and an objective evaluation, and we have 5 specific recommendations, 2 strategic recommendations, and 3 operational recommendations. Now, the main task for us is to move forward in terms of implementing the recommendations in a way that makes sense for all, so that we can all and then all of you, the facilitators and the participants being here, is really a testimony to your commitment to remold, reshape the HDC so that it works for everyone, towards not only towards the SDGs, but also beyond SDGs as well. So as Craig mentioned, we will be breaking into 4 different breakout rooms, which will occur simultaneously, parallelly. And the time that we've allocated is 30 minutes for the discussions in the breakout rooms. And after the discussions in the breakout rooms will then come back to the plenary, where each breakout room will present their discussions and the decisions and the discussions that they've had in the group. And the main objective of the breakout rooms is to delve deeper into the recommendations and to dissect them and see how they can be implemented, and also determine a timeline if it's possible. And most importantly, to see if there's any member of the HDC who would like to support the implementation of the recommendations. As you already know, we have a Google Drive folder. I think both Venya and I shared the link to the folder in the chat. And we have a template for each breakout room to kickstart the discussions and also to facilitate the discussions by the facilitators. We, as mentioned, 4 breakout rooms, and we have facilitators for each breakout room. For example, for recommendation 1, which is the scope of the HDC, will be facilitated by Nicola Wadra from the UKFCDU. Thank you very much, and will be supported by Venya and Rita. Recommendation 2 and 4 on the governance structure and the working groups will be co-facilitated by Pam Dixon and Maxwell and supported by Craig. Recommendation 3 on the country engagement will be again co-facilitated between Amos from Malawi and Heidi from Gavi, supported by Pandula and Isabella. Recommendation 5 on the advocacy and the communication mechanisms of the HDC will be facilitated by Letitia, and I will be supporting the facilitator and the group. mentioned, there is a template each for the breakout rooms in the Google Drive. So this is just an example. This is for group 1. We suggest everyone to appoint a timekeeper, rapporteur, and a presenter. 30 minutes, as I've said, for the discussions. And on the third slide, you will see that we have the recommendations so that it's easy for the facilitator to refer to and kickstart the discussions. And on slide 4, there are several questions. The group, we suggest that the group not to be limited by the questions on the slide, because as per the discussions, how it progresses, the group may like to add additional questions. And the 5th slide is for the rapporteur to record the decisions made by the group. And as mentioned, after the discussion, the presenter will have 10 minutes to come back to the plenary and present. As mentioned, the slide has all the recommendations. This one has the questions, and this is the template for the rapporteur to record the discussions. If there are any special consideration for the recommendations, if there are any volunteers to take forward the recommendation with the Secretariat and other partners, and also to determine a timeline if it's possible. What we've done is, as per the registration, we have already assigned participants to the various breakout rooms, ensuring that there is a balance in the membership of these breakout rooms. And after this, we should, it should automatically take you to the breakout rooms. And after 30 minutes, there'll be a reminder from the timekeeper and also the Secretariat, and we'll pull you back to the plenary. And I hope this is clear for everyone. If not, the Secretariat in each of the breakout rooms, the Secretariat will be there and will try to support in every way possible. Thank you, and back to you, Craig.
Great, thanks, Tashi. So once people are in the breakout rooms, we'll have half an hour. So the timing's slightly askew, but we're 3:05 now, roughly. And I suggest we'll come back at 25 to 4 to give 30 minutes for discussion. So Tashi or Mwenya, are you going to pull the plug, so to speak, to get people to their breakout rooms? And we'll see you in half an hour. And thanks to everyone for helping to facilitate. So Tashi or Mwenya, do you want to press the magic button? Thank you. Okay, so welcome back, everyone. I think as everyone's joining, what we're going to do now, I hope you had some really good discussions and got some good traction going, swapped ideas, brainstorming. Obviously, we just had 4 breakout rooms. What we'd like to do now, we're a little bit behind time, about 15 minutes behind time or so. We'd like to give each of the breakout rooms about 10 minutes, possibly less, to report back with your key questions. And between myself and Annalena, we're going to facilitate this discussion and draw some conclusions from your breakout rooms. And I was going to suggest, Annalena, that I was going to do the first 2 breakout rooms, and maybe you could help facilitate the second breakout room. So with that, I wonder whether we could call upon breakout room, whoever was your rapporteur, to report back to the planning on revamping HDC scope, which is recommendation number 1, facilitated by Nicola from UK FCDO. Okay, so do you have a rapporteur for the group who wants to present findings and recommendations and any support that you had? Thank you.
I'm afraid it's just me, I think, so. Yeah, so I'll go ahead. It won't take 10 minutes, I don't think. We kind of, our discussion meandered a little bit, and we started off by talking about the extent to which the new scope should include kind of specific country support. And I think there was varying views. On the one hand, that the way that the HDC set up and resource doesn't really lend itself to be able to provide that level of support at the country level. But then on the other hand, there's a real need to reflect countries in everything that we do. So country focus would still be good. How can we make sure that we're still having impact at country level? So yeah, there was a bit of disagreement not necessarily a disagreement. I think we all agree that countries are obviously the primary importance, like we want to have impact at country level, but I think it's that balance of how do we actually make sure that we do that if the HDC is not going to be providing country level support because it doesn't have the resource or set up to be able to do that. We also talked about the added value of the HDC. I think there's recognition that the HDC has a broad range of stakeholders, which is an added value, but there was some confusion around kind of how it adds to the, I guess, other initiatives and networks and groups that go on. So there was a bit of discussion, for example, around the G20 WHO initiative on digital health, which has recently been launched. And considering that's a kind of network and networks, and that HDC could potentially be linked into that, but there are kind of other things going on as well in other settings. Some reflection that even amongst kind of ways that we were trying to solve the problems of fragmentation are also contributing in some ways to fragmentation because, for example, there are different working groups, different donors, different programs trying to do some of the same thing, but not always in a joined up way. So it's sometimes maybe difficult to find the right place to do the coordination and to make the connection with wider working groups. What else? Yeah, also linking the link between the technical working groups and the country level is important, but has been quite difficult to do, I think, due to not so much engagement in the technical working groups by partners at country level, but it's something that should be supported. And then there was some discussion around stakeholders. When we're talking about different stakeholders at country level, they can be very broad, but who exactly are we considering and in what context? And then kind of in relation to that, the advocacy point, if we support a greater role of HDC in advocacy, then who is it that we're advocating to and for what? And that it would differ between different stakeholders within countries and at the global level. I think that is how much I've got from my notes, but they've probably missed quite a lot. So I welcome any other input from anyone else in Group 1 or anything I missed.
Anyone else from Group 1?
Maybe here, hello, here's Barakisa Tienbaza from GAZ. I was also in the group with Nicole. So I just want to align back to what Nicole was saying. I think definitely the HDC has a value in keeping open this working group to allow anybody to join. But I am kind of losing the focus whenever you reach you are in these small working groups. For example, the one which is currently running on capacity building, and Derek Momone from WHO was also in our group, so he had to join the other working group. So I felt that there is really a strong need of focusing on finding a niche for the HDC now, with all these initiatives going around trying to do the same coordinative activities. So it will be really good to try to find a niche where the HDC could still continue adding value in this whole coordination around health data. Thank you.
Barakissa. Anyone else from Group 1 wanted to add to Nicola and Barakissa? Or any volunteers?
Yeah, I should add that I'm sorry we didn't reach the point of asking for volunteers and who can support. I'm happy to try and get support from FCDO. We have a kind of means to seek bits of support from health advisors across the network, and I think it would probably be useful to have engagement from someone in FCDO that's not me. So I'm happy to try and get some support that way.
Thanks, Nicola and FCDO. Anyone else from Group 1 on the stability of the scope? If not, I mean, one of the questions we also had was supporting the Secretariat and developing the short concept note that that SEPA had suggested as well. And we're going to be trying to do that in the next month as well. We'll send out, I mean, after this, we'll send out a request for support to pull that together. Okay, so it's okay with you. Thanks, Nicola, and thank Barakissa and everyone in Group 1. We can move to Group 2.
Okay, so I'm Pam. In Group 2, we dealt with recommendations 2 regarding the governance board, and also recommendation 4 regarding working groups. So we had a lively conversation regarding the governance board, and I'm very happy to report that there is consensus that a small, nimble group would be preferable to the current structure. There really was no disagreement on that point. The comments in the group can be summarized. We had a beautiful rapporteur, Rachel Lucas, who was very helpful in this regard, but the details need to be worked out. The time, for example, what time commitment will be expected. And then, of course, there was acknowledgement that these are important roles, and getting the balance right is going to be important. And then someone mentioned something very intriguing, which was the timelines for evolution of the board. So, for example, there was almost a hint, a subtle inference that this is a board that will begin one way and perhaps might evolve as time goes on. But more details need to be worked out, and I think it would be very helpful to perhaps make a document that works out those details with input from folks. I'm going to now pass to Maxwell Onti, who led the conversation on recommendations 4 regarding working groups. Thank you to everyone in the group, and if there is anyone who has a additional thing to add in regards to the governance board, let's make a moment for anyone to add that, please.
No, Pam, thank you. So we had a consensus around how the working groups should progress based on the recommendations. The key components, and then we'll share that on the Google Drive, but the key components were that the groups work with other networks, members of the group work with other networks, and how can we make sure that there's collaboration with the other networks, and also within and across the working groups. How can we better improve the coordination? And the discussion from Nicola, the comment to make about the country focus also, we're also thinking through that. How can the working groups be more contextualized to share best practices with the countries? We all agree that the HDC and the working groups are not a tier provider, but we have communities within us who provide tier on HIS, and the idea of HDC is not to replace that. But how can the HDC become a forum for sharing and developing case studies and examples of what works best, and share best practices, rather than being the tier provider going to the country to focus to support with implementation. So we still can have a country focus without being a tier provider. I think that's the fine line where we agree. The other comment which was also made was about internal coordination, and an example was given that working groups that had 3 co-chairs seem to have fared better than the ones that had fewer co-chairs, because it's a heavy lift. So so the level of effort required could mean that we need to re-engineer how the working groups are structured. So those were the, if you like, 4 main buckets of where we agree. There were some other comments, but those were the main areas that we added on to the recommendations that concern the working groups. Team members, please feel free to chip in any area that needs more emphasis. Is there any other area that you feel needs emphasis? We didn't get to ask of how members can support the Secretariat on these recommendations going forward. But that can be taken after this.
Yes, I agree. I have no comments. I feel like the summaries were really good. We had excellent help with Rachel. Thank you, Rachel, again. And really, I think it was a very positive and helpful conversation. That's it for me.
Good. Craig, over to you, please.
Okay, thanks. That's for groups 1 and 2. I'm now going to hand over to Annalena. And Annalena's kindly agreed to facilitate working groups 3 and 4. So over to you, Annalena.
Thank you very much. Thank you very much, group 1 and 2. We are now going to move to group 3 and 4. Group 3 is doing country engagement, and group 4 is doing advocacy and communication, which is recommendation 5. So we can start with group 3, please. Group 3. Hello, group 3.
Hello, can you hear me?
Okay. Now we can hear you.
All right, sorry. I had some internet connection problems. Thank you. Just a very brief summary of what we discussed at the group 3. So one clear consensus was that half an hour was way less than what was needed to have a meaningful discussion on this important area. One question that we tried to answer and came up with some answer, that what should be the basically at the country level, what should be the entity of engagement for engaging at the country. So we had a discussion, and the recommendation was to designating, because there are structures at the country levels, different structures, designating one of the existing structures at the country level to work as an engagement port. And as an example, these are health partner forums or similar engagement structures. The consideration was for the WHO to map and engage at each country, and the WHO headquarters and country offices can do that. Without that, with the availability of the different technological platforms, 3 months would be a realistic timeline to do that. And the second recommendation for those questions was on building on the comparative advantage of the regional agencies, the regional presence of the agencies, to bring better the priorities from countries to the global and headquarter levels, and manage the supports and the capacity building which can be done. This is from what I was able to put there, but because I had some connection problems, maybe my my other group mates may want to add to what was said there. Thank you.
Thank you very much, Ali. Group mates, any additions to the presentation? Any additions? If nothing, if all is well, we can move to group 4.
Okay, thank you. Thank you, Annalena. I'm extremely grateful for the team. Our timekeeper was Sally Stansfield. Awesome job there. Rapporteur Mikhail Waga. Our presenter will be Anna Shaw. And really just opening up an opportunity once Anna presented, if there's anyone that would like to contribute. We really just unpacked in terms of who are our stakeholders, and there's some recommendations there. We looked at what how would we typically understand or obtain their needs without weighing them down with additional questionnaires or service in that regard. And one of the key thoughts was leaning very heavily, and extremely grateful for the SEPA work. And then just unpacking a little bit on the website and collaboration opportunities there. What we did not get to was just unpacking the various roles and responsibilities and resource opportunities there, and also specifically around the timelines. But we will take our cue. We agreed that just using the proposed timelines as a point of departure, and that can be refined. I want to give over to Anna Scholl to present our work. Thanks.
Thanks so much. And I think this was a great overview. I can just say that we really realized in order to truly understand AGC membership and their tailored needs, or specific needs in terms of communication, it would be good to have very detailed information about that, and a realization that this may have been already collected by the evaluators. So we would love to actually be able to get back to some of the detailed data and understand and maybe see how we can utilize this and leverage that information. If need be, we would actually move forward to additional kind of surveys or inquiries from the specific groups. In terms of the HDC meetings, I think that there was an agreement that with this recommendation and the interest of like really thinking about theme-specific approach that would actually attract specific groups. So not having standing meetings, but rather like really setting up the priority topic for conversation and examine also country level policies so that we can understand to what extent information can be utilized by them at the time when it's actually relevant. I think that there's still kind of a pending question: who are the audiences that we want to attract that may not already be there, and who are those who are members but not necessarily active, and what are their needs that we are not necessarily fulfilling? So all of this was kind of a part of the conversation. Finally, I think just the sense that we have is also that it's hard to communicate without confusion when we are coming with our own organizational affiliations, right? So one of the conversation was, how can we utilize existing website and other tools to communicate in a very cohesive HDC-like manner, so that the voices, of all these organizations are very clear in speaking from this platform rather than the unique perspective of each organization itself. And I think that there was, as you can see, some interest in thinking about chat rooms, if there are technical topics, themes, needs, use of those, and then also enabling specific country themes to actually be dominant in those, discussions. So as the emerging issues arise, how do we bring that to bear, but also how do we make these global goods, application of these global goods also known, so that we understand how they work and if they need adjustments. So I will open up to the rest of the group if they have anything to add.
Anything from other group members? Thank you, Anna and Latisha.
Thank you, Annalena. Thanks.
Anything? Otherwise, if there are no additional comments, I think we can thank the two groups for the beautiful presentations, and I hope the information is captured by the Secretariat. Thank you very much. Back to you, Greg.
Thanks, Annalena, and thanks very much to all the four working groups who presented back. So everyone's heard from the four working groups how they presented back. And I think from the Secretariat side, we'd like to kind of hear again from the SEPA team any reflections you have on the suggestions that came out of the four working groups. And also in the next sort of 20 minutes, it'd be good to kind of get everyone's feel or other feedback on your suggestions for the Secretariat on how we move this forward in the next 6 months. As I said at the beginning of the call, we are planning a face-to-face meeting in Kenya in the last week of November. And between now and then, we would like to work with many of you with your support to draft many of the things that have been suggested and present them more formally in that November meeting as well. So we've got a very tight timeline. We need volunteers, we need support to move this forward. But what I'd like to do during this discussion is, between myself and Annalena, help facilitate the feedback that you've heard from the 4 working groups. So I'd like to turn first of all to the SEPA team, if you're still on. I think you are, Kaveri, whether you had any reflections on the 4 breakout sessions from your side. And I think you heard a fair amount of agreement with the recommendations. It's just an issue of kind of the nuances of how to implement. So Kaveri or team, do you have any reflections or thoughts on what you heard from the HDC members? Thanks.
Sorry, Craig, if you could just circle back to us. Kaveri has just stepped out, so we'll come back to you in 2 minutes.
Yeah, no worries. Okay. So I just wondered, Annalena and I are going to facilitate this session, but are there any other comments or reflections on what you heard? People basically who weren't in different working groups, what you heard from others, anything that you'd like to say you agree with or disagree with, or want to volunteer for even? Let us know. Feel free to put your hand up or put it in the chat. Thank you. Ali, do you want to go first, and then Pam? Thank you.
Just wanted to say that, you know, from UN's perspective, we want to be engaged, we will be engaged, and, you know, even at the because now part of the data for impact department at UNAIDS at the global level has moved to Nairobi, so we will be happy to participate in all the discussions and the preparations here in Nairobi. I'm right now calling from Nairobi.
Thanks, Ali. That's great to hear. Thanks for your vote of confidence and support. Thank you. Pam, you had your hand up.
I did, thank you. I just had a quick question for the group that was working on country level engagement. Is there any thought as to what are the very next steps to start to move that forward in a positive direction? That was it. Thank you.
Thanks. Does anyone from the country group want to answer that? It's working group 3.
Hi, Craig. Can I yes, I was not in the working group, but I just wanted to say something on that, because when I started joining the HDC, I was also very interested in this country working group, and it's nice that a recommendation have been done here, but I think that is definitely, there have definitely been some discussion there, but that were interesting to consider also in our organization at when we are engaged in countries, but it's been difficult to continue work within the country working group, because there were less commitment from members in the country engagement group. I mean, the small working group, the country engagement, and we merge it to the convergence working group. But I have been trying to join this call many times, but it was not really forthcoming and active. So that was what I just wanted to give as a feedback. I don't know whether after this evaluation there will be then some drop down to this small working group and see how this can be merged and redefined. That would be interesting to follow up on that. Thank you.
Thanks, Marakisa. I wonder, just to support the discussion of the working group on country engagement, the breakout, I don't know whether Mwenya or Isabella or Pandula, you want to just describe to the group here the country engagement strategy and how we might actually use that and incorporate it in the coming 6 weeks or so? Wenya, do you want to just briefly explain the country engagement strategy that takes on board a lot of the feedback that we've had already up to now? Wenya, thanks.
Thanks, Craig. Just a quick point of clarification. Just Barakis has been referring to a country engagement small working group, and that's actually part of the digital health and interoperability group. So some here may not be familiar with what is being referred to if you're not part of the digital health and interoperability working group, but they indeed have a small working group on country engagement and also on capacity building and quite a few number of other small working groups. So just to respond to Craig's question here, so there is indeed a country engagement strategy with some overall principles of country engagement, as well as some slightly more detailed suggestions to approach in terms of how the HDC engages with different countries. The principles of country engagement, I think you've heard them all. The first is by invitation, not by selection. So indeed, we do try to stay away from this top-down approach of selecting countries and instead invite countries to participate. And with that, I think it's important to remember the ability to decline that invitation. I think if a country says no, we shouldn't take it personally and indeed give them the autonomy to do so. Engagement is often opportunistic, so you recognize that oftentimes there are many opportunities that come up in countries, be it through cycles, planning cycles, or maybe others that lead us to engage with or to reach out to a particular country. And of course, we try to align our engagement at all levels. So what happens at the country level should indeed be a reflection of regional sort of activities and indeed this ideal alignment with the global level as well. But in a little bit more detail, the country engagement approach, yes, it also spells out the principle of country engagement, but it also tells you about the type of engagement with countries. So whether it's a strategic request from a country or indeed a call for collective action within a different country. It spells out what the HDC will fund. And we know it's not a funding mechanism, but nonetheless, some catalytic funding in some instances, rare instances, has been sought to support one or two priorities. And also it tells you where the HDC will engage. And the simple answer to that is everywhere in any country. And indeed can engage with the HDC, but there's a few sort of details here as to where specifically the HDC engages and why there may be one or two countries being focused on. And then we have some best practice of country engagement and indeed how information ideally should flow from the global level, from the HDC and through to our country colleagues. I hope that's helpful, and I'll hand it back to you, Craig.
Thanks, Wenya. And again, sort of lastly, I wonder whether I could ask on Elena, if you're there, to maybe contribute a bit more on from your side in Botswana. You created your own HDC in a way. Do you have any thoughts on the country engagement strategy in terms of what's worked and what hasn't from the recommendations that we heard in the evaluation point of view? Just any practical suggestions on Elena, just a few that might have worked in Botswana that could be adapted or used in other contexts on Elena. Thank you.
Okay. Sorry. I think what worked in Botswana is the fact that there already in the ministry was a structure that was responsible for data and data management. And therefore it was natural for HDC to be anchored on that particular structure. And then the structure implementing the roadmap made it easy to kind of implement the ideals of HDC. However, I really think we were not able to be as engaging as we should be in terms of really reaching other stakeholders who actually need to be part of the HDC. We need to do a little bit more on that aspect. We need to be visible, we need to be known, but that has been a challenge that we need to address. But otherwise, in terms of implementing what needs to be implemented. I think the department, being the one that is leading, actually did a good job in that. Thank you. Thank you very much.
Thanks, Annalena. Sorry to put you on the spot, but I think it's important, and those are questions as well. I wonder, just quickly, wonder if Amos, you're able also to reflect from your perspective where you are, from a country perspective, what makes things work and what doesn't, and do you have any suggestions for us moving forward on implementing these recommendations, Amos, from a country perspective? Thank you.
Thank you so much. I think from Malawi, maybe what we need to clarify is the local level engagement with HDC. There is already a platform where donors, many of whom are members of HDC, does engage with government, and there's some sort of more structured engagement platform of sorts, which I think we can leverage on that in terms of how then HDC could engage with as a HDC with the various the field people that they have to be engaged. But I think it would be important to already reflect our current situation with what's already there in the engagement and the engagement strategy, so that we can best align ourselves.
Thanks, Amos. And again, sorry to put you on the spot. We didn't hear everything, but I think we got the general points and just of Malawi's successes as well. Thank you. Wonder whether hoping Kaveri might be back now. And Kaveri, I know you're away for a bit. We were just asking from your side in the SEPA team, was there any reflections of the feedback that you heard from the breakout sessions and teams? I mean, I think you heard a resounding congratulations, but also most are very much on board with the recommendations. The question is how to implement them. Were there any nuances in your thinking or reflections on that, Kaveri, just from the evaluation team's point of view?
Yeah, thanks, Craig, and apologies to miss you earlier, but just very quickly, precisely as you say, there's general sort of agreement with the recommendations, which is really good to hear. I think for most breakout sessions, they didn't really manage to come to a discussion on who would contribute and how, and also a suggestion on resourcing. I think Nicola referred to in some support from SCDO in terms of the health advisors, but I wonder if that is something that we could just spend a couple of minutes talking about, how to generate that support to help sort of take forward some of the initial recommendations.
Thanks, Kaveri. I think Steve had mentioned it at the start as well, but I don't know whether any other colleagues want to kind of talk about resources, and in terms of resources, not just financial, but political and technical, and basically volunteering to support this in the next 6 months. Or any thoughts about long-term sustainability of the HDC in terms of funding? So Pam, you have your hand up, but it would be good to kind of get others to chip in who haven't necessarily spoken as yet. Go ahead, Pam. Thanks.
Yes, hi, just very briefly. I was wondering, it might be really helpful to get some of these in writing and to gather feedback directly from the constituency and kind of do a summary. I think that there's a lot of resources represented here on the call, and I know that, I think folks will probably need to go back to within their organizations and to make sure the resources are available for that sort of thing. I'm just making a guess, but I think a written thing might be helpful. Thank you.
Thanks, Pam. And just as a way of kind of follow up, obviously the evaluation itself will be made available online, as with the 6 country case studies, and a resulting manuscript of this call as well. So it's going to be made available, but also the specifics of the breakout room and deliberations as well. But I wonder, was there any, I mean, Nicola, thanks again for potential support from FCDO. But are there any others on the call that want to kind of mention potential support? I mean, as we circulate things in writing and give an opportunity again in November to do so. In terms of, I realize Heidi, you're on the call here. I'm not putting Gavi on the spot, but have you or Global Fund? I mean, we had a discussion with the Global Fund earlier in the summer and GFF on this. I don't know from your side in Gavi or the other global health initiatives, have you had any thoughts or thinking on this on providing support for the HDC, Heidi? Thanks.
I mean, my thought on this is, you know, there's sort of two things. One is, I think, you know, there is a recommendation or a finding related to some of the, you know, some of the lack of seniority of the people, not, you know, like of the participants who come regularly and stuff like that. And so, I don't know, my thought would be like in some of these cases, and, you know, this is also sort of aligned with some of those recommendations around having a board, is like getting that more senior level commitment would help. I think, you know, could potentially help, even if the doers are others. And so I would suggest an approach like that as well, in terms of like how to reinvigorate some of the resources that are put toward it. That would be sort of where I'm coming at it from.
Thanks, Heidi. So you mean on a more regular basis? So like the small board that is recommended actually be senior level decision makers, or are you meaning engaging senior level decision makers with advocacy?
I think in this specific thing I'm talking, I mean, to answer about getting resources, I think that there are cases where the organization, where like re-engaging senior level commitment to supporting the HDC, whatever that may look like, but particularly from a resourcing perspective, and if you're looking at people's times and stuff like that, I think that could be that I would look at that approach as a way of generating resources. You know, from a human resource point of view. In terms of other types of resourcing commitment, I can't really comment on that at this time, but I think some reinvigorating some senior level and, you know, support for HDC with certain organizations, I think would help.
Great, thanks, Heidi. And just for information, I think there was a couple of chats on it. We are engaged peripherally with the data dividend work, which is broader than health. But that's revolving around much more of an investment case for data per se, with a country lens to it as well. And that was one aspect that we were going to follow up with. Abonishi, do you want to go next? Sorry if I mispronounced the name, Abonishi, but good to have you here. Thanks.
Thank you. In short, I'm Ambo. Talking from Malawi, UNICEF country office. My colleague Dr. Amos Nyaka has already imputed quite a lot, but I think I hope I'm not taking you back to the discussion that was already taking place, but I saw that there's a discussion about GFF and Global Fund and the possibility maybe of leveraging these institutions for funding and the like. I think one thing that I've noted with HDC to date is maybe the lack of clarity within on how financial support would go to various country needs, be it in data generating systems, strengthening the systems as a whole, but also specific to systems like CRVS. So I think going forward, if we would engage such institutions, I think using the leverage that HDC has, it would be good also to be very clear on how the countries can be supported to access funding from such institutions to support strengthening the systems, because otherwise, if it's not clear, I think we'll continue to have a situation where involvement and engagement of both ministries and other partners on the ground will be difficult to harness such to come together around a cause, because they will feel like the needs that are on the ground and the support that comes mostly maybe will be technical, which is also very important, but but also still more with the technical support requires also the financial investments into the interventions. At the same time, being clear on if the resources that are mobilized, how can they be channeled towards supporting the specific country needs. Over, and thank you. Yeah.
Thanks, Ambo. Some great points there. Thank you. I wonder whether we're just going to wrap up in a bit, but I realize Sally Stansfield is on the call, and you probably might not want to be put on the spot, but I want to ask you, Sally, because you work with the Gates Foundation, obviously. You're previously the head of the Health Metrics Network, and you're obviously engaged in multiple levels, country and global level, with a lot to do with health information systems. And I wonder whether, Sally, from your side, I mean, you may not have had a chance to read the evaluation, but one of the recommendations was an investment case for the HDC, or how do we resource the HDC? I wonder whether you have any thoughts for colleagues from your side and your experience on resourcing the HDC as we move forward, not only the next 6 months, but seeing it through to kind of 2030, Sally. Do you have any thoughts on that? Thanks. And sorry to put you on the spot.
Yeah, on big spot that I'm on. All right. No, I will. A couple things. I do think and we've talked about it before and have, I think, made some progress on it. But I think the investment case work is really important, both at the country level, as well as at the global level. But one thing that haunts me a bit, and you may be able to clarify this, and I would profit from reading the evaluation report as well. But there's often a bit of a conflict between global level data needs and the stakeholders at the global level and country level data needs. The actions we would take to kind of strengthen country owned information systems are pretty different than what we would take to improve access to and use of data at the global level. And I guess I'm a little unclear, and I look forward to reading the evaluation report about where we come down on that issue. Which takes precedence as a goal and an outcome. You can feel free to set me straight on that, but I think that's kind of an interesting issue that we need to confront, especially as we're trying to raise resources for this.
Yeah, so I mean, my understanding, Sally, from the evaluation is much more slanted as we move forward towards supporting country needs and more of a kind of a country-centered lens on health information systems, if that helps.
Yeah, that does, and that is brings joy to me. I think that is I think that's the way to go. Great.
Okay, thanks, Sally. I mean, do you have any other experiences to share on engaging with, I mean, obviously most of the funding actually comes from Ministries of Finance, but anything in your experience you wanted to share, what worked and what didn't when you're looking at supporting country health information systems from a donor point of view and a financing point of view?
Yeah, I think, certainly one thing we learned was that, that making the investment case at the country level was powerful in trying to mobilize domestic funding within developing countries, but and making sure that the in-country stakeholders are fully empowered. I mean, that investing in helping them make the investment case is probably the path to sustainability. But in the meantime, there are, I think, the trick with global level donors, and the average funding agency is really, I think we should invite those donors to adopt a piece of the puzzle, whether that may be funding countries to strengthen their investment case, or funding countries to take on, you know, a specific technical issue so that they can really lead on something. Those are the kinds of things that I think the global level donors would love to do, and you know, and then they can really kind of take credit for and be engaged in trying to achieve pieces of the puzzle that need to be delivered to make this work.
Great, thanks, Sally, for sharing your perspective and experience. And we're kind of taking note of that investment case work and this kind of, I like it, the concept of piece of puzzle. I'd like to, Francis, you have your hand up. You put something in the chat, which is great. I wonder whether I could turn to you first, and I would like to just ask Anna from USAID if you have anything else to say, just from a USAID point of view, and Zen from CDC to lastly talk, and then I think we'll wrap it up with next steps. So Francis, and again, I don't want to put you on the spot, but Anna, if you have anything to say, or Zen, if you have anything to say. So Francis, over to you. Thank you.
Yeah, thanks very much. I really agree with the country level approach. I think that's essential. That has to be, it can't be done otherwise, because that's where health data is located, and that's where the responsibility for the health data is as well. However, there are probably certain things that we can do at an international level that can help that, and some of that might be, for example, building data infrastructures or data curation systems or something, models or something, templates, and also data policy kinds of issues that would help the in-country, those people who are responsible within their countries to implement this much more easily.
Thanks for your agreement, basically, Francis. Thanks, and thanks for your offer for support in the chat. Thank you. Anna, do you have anything to say you want to contribute? Anna, sure. Go ahead.
Thanks so much. So yes, I am actually really excited, and thank you to the evaluators and Craig, to HDC Secretariat for organizing this. So I'll just say that I think that we are always kind of working in this kind of this continuum between the global goods and actually solutions that are very tailored to countries. And I think that there's something to be contributed on both sides. In terms of the country, you know, I feel a lot of health specific work, health area specific work is, you know, the silos we see in terms of funding is still kind of something that we need to find a way to move away and find those things. So across different initiatives, whether they're US government or multilateral, I think that there is a huge benefit of us working together at the global level to see where those points that can be leveraged can be established at the country level, not just at the global. So just wanted to add that, and I think what those the work in maternal and child health and you know, HIV/AIDS, you know, we are constantly, you know, working on this, but I see also at the country level, this would be great contribution to actually supporting that kind of communication between the global and country levels. Thank you so much.
Thanks, Anna, and thanks for USAID's support throughout. I know Rachel had to step off, but thanks. Zen, do you have any comments kind of from a CDC point of view? Thanks.
Sorry, Craig, just we've had our network drop, so that's why I've been joining back and forth on the mobile. Thank you all. I thought the evaluation was quite useful and the presentation was quite useful. And you know, maybe a few tweaks in the recommendations, but in general, being fully supportive. I mean, I'm happy to think about ways in which CDC can further support the work, and anything on our end that can be supportive, we're happy to do. But appreciate the session. Thank you.
Great, thanks, Zen. So just in wrapping up, first of all, I'd like to thank my colleagues Tashi and Mwenya and Pandula and Nina and Isabella, some of whom are on the call. Huge thanks for them for making this this call work and designing and working with many of you from the Secretariat side. In terms of wrapping up on next steps, obviously, as I said, we will do several things. One is to make the evaluation publicly available on the website. We will send round a note for the record of this meeting and very concretely look at the recommendations and some of the feedback we have from the breakout sessions to take this work forward. And over the next 6 weeks, thanks again for many of you who volunteered to support, we're looking at revising the theory of change, putting together a fairly strong work plan that we can present to you and members of the HDC in November in our face-to-face meeting, and really looking at some of the governance angles and redesigning the HDC so it's fit for purpose. Over the next 6 to 8 weeks, that's going to take a lot of collaboration, a lot of coordination with you all, and we value that. I mean, as I say at the beginning, it's your collaborative, so we hope to make it work so that we're in a strong position in November when we have our face-to-face meeting to really look at how do we resource it, who's going to do what, and we've done a lot of the kind of the background work from the recommendations between now and November. Again, it's kind of looking at a 6-month time frame of really implementing things that need to be in place to reposition the HDC. So with that, I'd like to give the last word actually to Onalena from the Ministry of Health in Botswana, and a huge thanks to Botswana government and also Onalena specifically for being such a champion of the HDC, but also sharing very frankly what's working and what's not. So Onalena, I'm going to give you the last word on behalf of us all. Thanks, Onalena. Over to you. Thank you.
Thank you very much, Greg. No, I just want to take the time to appreciate the members who are here and who have contributed so immensely to the way forward, and hope to meet them again where we are going to be now doing the implementation plan for the next 6 months. Thank you. Thank you. Over to you, Craig.
Thanks, everyone. I think we call it to a close. Thanks for everyone for joining and all your inputs. Thank you.
Take care all. Bye-bye.
Thanks.